All right, today we are diving into something huge. It's a simple idea, really, but one that could literally change healthcare for an entire continent. We're talking about AfriPharm Health and their mission to connect Africa's healthcare system one piece at a time. So let's just start with this one question. Think about it. What if the hospital actually knew you were coming? I mean, really knew. In that critical moment, what if they weren't just waiting for you to show up, but were already getting ready for you? What would change? Well, turns out pretty much everything. Because right now, for way too many people, the reality is the complete opposite. You get there, and to the doctors, you're a blank slate. They know absolutely nothing about you. Your allergies, your past medical history, any chronic conditions you might have? Nope, nothing. And if they don't have that history, how can they possibly prepare? They can't. The right specialists? They're not on standby. The right gear? It isn't ready to go. The whole system is just stuck, reacting, instead of being one step ahead. So in that information vacuum, the one thing you can never get back is lost forever, and that's time. We're talking about critical, life-saving time. Look, this isn't just some hypothetical scenario. This is the daily reality of what happens when hospitals have to work blind. It's a massive systemic problem, and it's all about the huge cost of having disconnected data, a cost that's being paid by health systems all across the continent. And don't just take my word for it. This isn't just a collection of stories. The World Health Organization itself has put a spotlight on this, saying that fragmented patient information systems are a major barrier to getting efficient care. So you see, this is a deep foundational problem, and it's going to need a foundational solution. Okay, let's get specific. Look at Kenya. The Ministry of Health and the World Bank found that patients coming from rural clinics often show up at big city hospitals like medical ghosts. That's a powerful term, right? Doctors have zero information. They're forced to start from square one, redoing all the tests, wasting precious time and money. And it's not just Kenya. You see the same pattern in Nigeria. The African Journal of Emergency Medicine found patients having to do the same lab tests again and again and again, just because their records got left behind. I mean, it's not just inefficient, right? It's dangerous. It causes major delays when every single second counts, like during an emergency. Hop over to South Africa, and you'll hear from Médecins Sans Frontières that emergency rooms are just overwhelmed. And a big reason for that, it's the same old story. The patient's information doesn't follow them. It's like a traffic jam. It creates these huge bottlenecks that just ripple out and slow down the entire system. And this one really hits home. Let's talk about maternal care in Ghana. The Ghana Health Service has found that hospitals often get emergency referrals for mothers with zero advanced warning. Can you imagine? Preparation for a high-risk birth doesn't start until the mother is literally at the door. The delays that this causes, they can be absolutely fatal. Okay, so the problem is crystal clear, right? It's widespread and the consequences are incredibly serious. So what do we do about it? Well, this is where we see a huge shift in thinking. It's all about connecting the system to create something new, a paradigm called prepared care. And this chart just lays it all out perfectly. On one side, you have the old way, reactive care. That's where the information shows up with the patient, and the hospital is just scrambling to react. But on the other side, that's prepared care. This is where the patient's intelligence, their data, gets there first. This lets the hospital actually prepare. It's a total game changer, moving from reaction to preparation. So what's the engine behind this new paradigm? Well, at its heart is a really powerful piece of technology. It's called the Patient Health Vault. And the whole idea is to hold your entire life's medical history in one place that is super secure and, this is the key part, completely portable. So what exactly is the vault? The best way to think about it is like a digital passport for your health. It's this secure system that lets your vital medical info travel right along with you safely and securely, no matter where you are on the continent. When you break it down, the vault really has 3 core jobs, and they're all super powerful. First, it's the one place for your entire lifetime of medical records, everything. Second, it's an archive for your family's health history, which can give doctors huge clues about genetic risks. And finally, number 3, it wraps all of that up into that portable passport we talked about, making sure your complete health story is right there when it's needed most. All right, so that's the tech. That's the big idea. But what does it actually look like in the real world, Let's dive into prepared care in action and see how this whole connected data thing can actually save lives when it really matters. First up, we're jumping right into a high-stakes scenario, an emergency trauma case in South Africa. This is one of those situations where every single second counts. And just look at how this information flows. It's incredible. An alert goes out, AI triage immediately figures out how serious it is and escalates the case. So before the ambulance even pulls up, the hospital already has the patient's vitals and their entire medical history from the vault. And the result, the operating room is already prepped and waiting. The patient gets to bypass the ER logjam completely, and treatment starts the second they're through the doors. Okay, let's switch gears now to a totally different situation. This next case is all about family health and managing chronic conditions, this time in Ghana. So picture this. A kid with severe asthma is traveling with their family, and they have an attack in a new city. They rush to a new hospital. Now, normally this would mean starting all over again, but not here. The doctor instantly pulls up the child's entire history from the vault: diagnoses, allergies, medications, even family medical patterns that might be relevant. The result is just seamless. No repeated tests, no dangerous guesswork. The right treatment continues right away. That is what real continuity of care looks like. But a system like this doesn't just solve today's problems. It actually opens up a whole new world of possibilities. Take medical tourism, for instance. A patient in, say, Nigeria could have their full medical records, their scans, their lab results, their entire history, securely reviewed by a top specialist in South Africa before they even get on a plane. This makes care across the continent a genuine workable option. It's huge. So when you start putting all these pieces together, the emergency care, the chronic conditions, the new possibilities, you see that it's so much more than just a few cool use cases. You start to see the big picture, and that picture is nothing less than the future of health in Africa. We're talking about a truly connected infrastructure where the right information gets to the right people at the right time, freely and securely. And this all leads us to one final, really important idea. We've been saying healthcare shouldn't begin when you get to the hospital door. So where should it begin? The answer this whole system gives us is that it should begin the moment there's a problem. It begins with information leading the charge, making sure that by the time you actually get to that door, your care is already underway. And that vision, right there, is what's driving AfriPharm Health. Their goal is so simple, but at the same time, so incredibly profound: connected care for Africa. It's a future where data isn't just data, it's what saves lives, one connection at a time. Thanks so much for joining me.